Welcome to welcome to Raw Take One, the lifeline of your unfiltered media experience. Before we start the show, don't forget to like, comment, and subscribe. And if you're on Facebook, like, comment, and share. I'm your host, Gion Thomas, and this is my co-host Archie. And we're so glad to have him back. And we have a special guest, clinical supervisor and host of the Keto 911 podcast, Mr. Daniel Sells. And today he'll be talking about his life. He'll be talking about his life as a first responder. So go ahead, Daniel. Tell us a little bit about yourself, man.
Well, thank you guys for bringing me onto the show. I do appreciate the opportunity to speak and share my experiences along with everybody here. As you all said, my name is Daniel Sells. I'm a clinical supervisor at a pain management facility right now. I still am and currently hold a current licensure as a EMT basic. I've been an EMT basic since the beginning of COVID, my certification started in January of 2020, and I literally started working in EMS at the beginning of COVID, the first wave, that is.
So, man, tell us about the rise of COVID and some of the things that you've seen being a first responder.
Oh man, okay, so about the time that I had gotten on with the private service EMS that was connected to a hospital in East Texas in February, there had already been rumors about the so-called coronavirus being, overseas. Mm-hmm. We were like, oh, well, we're fine. It's not going to come over here. They were looking at us like, no, it's not if it comes over here, when it comes over here. So things actually progressed kind of weird, and then all of a sudden when it started to spike, it went crazy. Mm-hmm. So we were transporting a patient into the ER. The next thing you know, here comes the medical director saying, hey, protocols changed, everybody needs to put on these masks. Wow. Okay, a little bit later we go through stuff like that, protocol changed again. I'm talking about protocol was changing because it was progressing and progressing and progressing. By the time it hit Texas, we were like, they didn't know what to do. So we were learning how to deal with this as it went. And then, I got my first call that was a COVID patient. Well, it wasn't a COVID patient until after the fact, after we found out. So we wound up arriving to the scene, we're getting the patient and everything like that. The patient's diaphragm means he's sweating. He's just having trouble breathing and everything like that. And we get him situated into the ambulance. And by the time we were on our way there, he looks at my part. He says, man, I'm about to flip and die. Wow. So normally being us, when you hear that, we're like, okay, no, let us get you situated first. We're going to get you taken care of. Okay. Don't worry about it. We're going to get you taken care of. So in the process of us getting him over to the ambulance, he goes limp. So we worked on him for almost 40 minutes. Long story short, he winds up passing away. He winds up dying. And then we wound up learning, where he worked and all that other stuff. And then after that next morning, when I'm getting ready to go up to my shift and go to work, I find out from the news that where that man worked, they just had a huge COVID outbreak. So he wound up having to shut that whole plant down. And the second day, I'm serious, right before I was about to call my partner texted me and he was like, did you just, I said, look, man, I was just about to text you. So we had to text our regional director. We were like, hey, he came from the place that literally everybody just shut down because, they had multiple people testing positive for this stuff. What do we do?
Yeah.
And they were like, well, we just have to kind of monitor it, and just see how things go, because it was all still brand new. And as things progressed, the cases started rising and multiplying, and then we had that huge shutdown. And everybody remembers toilet paper became currency, more valuable than $20 bills. I'm serious. You go dang near pay your rent with toilet paper last year. I think y'all can agree with me dang near.
Yeah,
so
it was great.
Everything shut down, and then the calls shut down. The hospitals weren't doing elective procedures. They were laying people off, kind of almost what's going on now. And then when it started to pick up again, I used to transport maybe one COVID patient every 2 or 3 shifts, to where I was transporting 14, 15 COVID patients a shift. And then having, in EMS, you work 12-hour shifts. So it wouldn't be a whole day to where it was nothing but COVID patients. to where literally, the second we get the call, PPE alert. As soon as we hear PPE alert, we knew exactly what it was. Time to get our respirators, because we had the big old painless respirators that our CEO purchased himself, because you couldn't order them in bulk. So our CEO wound up purchasing them each individually for us. So we had the respirators up, we had the face masks, we had the full gowns, we had protocols that we had to make sure we took all the loose stuff. So we had our backpacks and stuff like that in the back. We put them in the front. We sealed off the partition, and we transport the patient. We weren't allowed to do CPAPs or do our protocols, because we didn't want to aerolize it. We didn't want to mystify it in the air, because you're trying to make sure that you reduce as much of the contagion as you can to yourself.
Yeah.
There have been many of EMTs and paramedics that contracted the virus at the beginning. Some of them actually died from it, because it was still trying to be figured out. I caught the virus back in December, literally the week of Christmas.
Wow.
So, I have been feeling bad. My throat was scratchy. I was spitting up blood, actually.
Wow.
And I went to go get checked out, because I'm thinking, it's just, strep throat. I don't have it. Didn't have any fever or anything like that. Got tested that Monday. They called me and told me I was positive. I opened up my bedroom door to look at my wife and with my mask on, and I just nodded. And I closed the door.
Wow.
That was the worst feeling I could ever imagine, ever happening. But the biggest thing that all first responders, including now, we worry about bringing it home. They tell us, if you can, shower at work, but by the time we're getting off work, everybody's trying to shower, and there was only one shower. So I just, got home and I started stripping from my car to walking up to my apartment complex. I don't have a house, stay in an apartment complex. So I was giving everybody in the apartment complex a free show while I was walking up the stairs to my apartment complex, so that way I could strip down. My wife and my kids had to stay in the back room while I took all my clothes off of me directly, put them in the washer. I disinfected my whole trail of me walking through, and then I went straight to the shower, decontaminated, and then sterilized my bathroom with Lysol and everything, and then I was able to come outside. I still, at that time, wouldn't let my kids get close to my face. I wouldn't let my daughter get close to my face and give me kisses or anything. It was to the point to where literally, every single time I got cleaned up and I was coming out, my daughter would be like, "Okay, Daddy, can I hug you now?" And I'm not the only one that's had to experience this. Now, given my experience is probably vastly different from from anybody else's, but this is what I had to deal with. My kids were preemies. I worry about their immune system and everything like that. So literally, I was worried about bringing it home every single shift, to where it was, I wasn't sleeping. I was paranoid about everything. I didn't go visit anybody, didn't go visit my family for months. Behind it, my grandparents were, while they were still living, asking about me. And I'm like, hey, they're like, when you gonna come down? I'm like, not no time soon.
Yeah.
Unfortunately, I lost both of them to the virus. One in December, and the one and my grandmother in January. And recently, my sister, she's still in a hospital now. She's been in the hospital for about a month, a little over a month now. She contracted the Delta variant, had to be on a ventilator, and she's finally now off the COVID wing. She was more than fortunate enough to make it out to where she's now doing physical therapy and trying to get home. But I know way too many other people, fraternity brothers, good friends, family members, who have not made it. And even more so that, the toll is still going up, to where if you see the deaths now, how many people have died due to it, which they don't talk about in the news anymore. I can now put names to those numbers.
Yeah.
There's many people who can do the same. And it's a stressful situation. I got a good friend right now. Is one our daughters were born on the same day. He works with the fire department and EMS out in Longview, Texas. Got a chance to text him the other day just to see how my good friend, and brother is doing. He's like, man, I haven't been home. He says, I'm hardly ever home. I got to get rapid tests every single shift. I said, it's got to be. I said, I know how bad it is. He says, man, you just don't get the you don't get the half of it. He says, I've run so many shortness of breath calls that I've become a pro at respiratory, that respiratory treatment. Because that's just the belly of the beast. The first responders are I'm serious. I know nurses, and I'm not gonna discount the nurses, because I had an awesome team of nurses that took care of my sister, which there were awesome teams of nurses and doctors that work in this pandemic that's still going on, that are tired, that are overworked, that are stressed out. You got some of the nurses that are not want to get vaccines, so the hospitals are letting them go, and everybody's short-staffed. I now work at a pain management facility. We're short-staffed, because we have people who are sick, patients that are coming in. We don't know what's coming in off the street, and that paranoia, that stress or PTSD, if you call it, has never left me.
Yeah.
I worry about my kids. We pulled our kids out of school, public school, because when my wife started looking at me when the school year was about to start, but she was like, so what do you think? I said, I don't know. She says, have you heard anything? I said, no, I haven't heard anything yet, but the second I start hearing something, we'll let you know. At that time, it was like 86 cases. By the end of that week, it was over 800 cases.
God damn.
Literally. In the span of a week, about 80-some cases to 800, almost 1,000 cases. Now listen, my wife all said, pull them out. Because our children are in elementary school. They're of the non-vaccination age.
Yeah.
To where, one, I can't take that chance, because I've seen what it's like to be on the COVID floors, to see people on ventilators, and an entire floor of people on ventilators. This was last year, and I've seen this. It hasn't changed. It's the same thing. People on ventilators. I've transported patients from the COVID wing to hospice to die because they're not. Yes. Go ahead.
Let me ask you a question. In school they show videos of like car accidents and driving wrecks and stuff like that to I guess encourage kids to become good drivers or whatever. It seemed more like a fear tactic, but for whatever reason they show these videos. So with all the things that you've seen, the horrors that you've seen dealing with COVID, what would you say to the public? How could you use what you've seen and give a message to the public to implement more safety guideline and wearing a mask and get vaccinated?
So here's the thing: when it comes to COVID, and I'll give you another example. I had a patient that we had to transport, and let me give you the science behind how COVID works a little bit. So when the virus attacks your lungs, it prevents the gas exchange of the carbon dioxide to the good oxygen from happening. So you can be breathing clearly sometimes, but since it's not happening, your oxygen saturation is low, which causes you to have trouble breathing because your body's trying to fight to get that oxygen in. We had a patient to where good oxygenation is from 100% to about 95. Anything below 95, we worry about. By the time we picked this patient up, her oxygenation was at 70, 74, 76, which is 20 points less than the worry area. So imagine not being able to breathe. Imagine not being able to function, to move. Your body is just sore. And then you have to go to the hospital and you're alone. Because nobody can go there with you. Nobody can go hold your hand. It is one of the most terrifying feelings that somebody can actually feel. And I had to tell my sister this when she was gasping for air, coughing and all that. And I told my other sister who was there with her, I said, pass her the phone. She says, hey, Kate. She says, she calls me Day Day. So she said, hey, Day Day. I said, I need to have a real uncomfortable conversation with you right now. She says, what you mean? I said, you're not going home. I'm pretty sure you have COVID, and by the sound of what you're coughing, I think you have pneumonia. And come to find out, she had the Delta variant and pneumonia in both lungs. And I had to tell her, you're not going home. You're going to have to stay here. They're going to admit you. And I gave her a scenario based off of my experience of what to expect. And lo and behold, I said, I'm telling you this now so that way it's not a shock to you later.
Yeah.
And that's the thing. And that's a benefit that she has with me, is that I was able to tell her.
Yeah.
Everybody else don't have that.
Right.
No, everybody else doesn't have that ability to kind of walk somebody through, so that way you're not just going to panic like most people do when the situation changes. Now, given she did have her moments of highs and lows, and she had some lows to where she had to be prone and all that other stuff, just like most normal COVID patients had to do. But the emotional and psychological toll that it will take on your family, knowing that they can't get to you. It's not just, it's going to be it's scary enough that you have to go in there by yourself. Imagine if that's your child.
Yeah.
I have an 8-year-old and a 7-year-old. That concept terrifies me more than anything else in this world now. I know what it's like to see people struggling to breathe without COVID. And I know what it is to see people struggle with it. To see a child do that, that's the worst nightmare. That's the worst case scenario nightmare that I don't want anybody to ever have to experience. And a lot of people won't say, well, I got the antibodies, I got this, but guess what? Somebody in your family probably doesn't. Somebody that depends on you may not have that. Mm-hmm. So you have to think about it. Is it worth putting somebody that you cannot console, that you cannot walk through a process, be in that situation and have to go through it alone? I've seen too many times where people have had to talk to their loved ones who are on a ventilator through video chat, Facebook or whatever, Facebook Messenger, video chat, or talk to them while they have a BiPAP on, while they're struggling to breathe, trying to tell them that everything is okay. Yeah. My family was like, oh yeah, everything is good. Everything. I said, look, you're talking to the wrong one.
Yeah.
I don't need hope. I go exactly by what the facts are and what the doctors and the nurse are saying. What I got from them, I was able to explain to my family to keep my mother, who had just lost her mother and father, off from going off the deep end, and to keep myself sane, because I knew what was going on and I'm powerless.
Yeah.
I couldn't even be in the room. I'm like, if I can monitor vitals, if I can do something, I would be able to sleep at night. But that's knowing what I know. There are people who don't have that.
Yeah.
The hospitals are packed, people. In North Texas, there are no children ICU beds. If a bed opens up, about an hour or two later, it's gone, if not less. Hospitals on full divert. In East Texas, they were stating that women who are pregnant have to look at potentially getting midwives because they may not have room for them to deliver the child. Now, think about that.
That's asinine.
But that's just the world that we're in now. Everybody's been putting it off and politicizing it.
Yeah.
But let it hit home. Let it hit home. And then, or let it hit you. When it hit me, I was like, I'm already in the field. It's like, it's not if, it's when.
Yeah.
But my children, and people can be like, oh, well, you're field mongering and all that other stuff. Okay. I'm going based off of pure experience. I hope and pray that nobody has that experience. Exactly. There are ways to prevent that. Wear a mask. It's simple. Wear a mask. A surgical mask. Oh, well, the particle filtration and all this other stuff. I've never seen so many Facebook doctorates that are in my entire life. People who can't even spell U-Y-O-U in social media. All of a sudden got a PhD doctorate in biomolecular chemistry and infectious disease. They can barely even read. And I'm sorry, I'm going on a high horse because I deal with it daily.
Yeah.
And that's in my current field where I'm at now, and that was in EMS, and that's in the neighborhood too. Go ahead. What's up?
Well, no, man, I totally get where you're coming from, because the people who try to deny COVID, it's like basically they're denying your reality. It's like the things that you go through, the things that you've gone through, and the things that millions of other people here in America have gone through. It's like it's null and void. Like we don't, like the anti-vaxxers don't believe us, and so those people. It's like you can't even reason with those people. It's
But you know what? There have been people on CNN who were anti-vaxxers, who they interviewed and said, "This is real. I thought that I had the antibodies," and some of them were in the hospital for the second time. In ICU again. There was a husband and wife that were just in the hospital together, second time, and there was another woman who was like, I had it. This is my second time getting it, and she wound up passing away a couple weeks ago. Heck, even we got Republicans catching it. Hot Wheels done caught it.
Right.
If anybody wondering who Hot Wheels is, if you haven't caught that together, that's Greg Abbott, who unfortunately will be in Tyler, Texas tomorrow.
Wow.
Anyway, but he caught it. But he was like, "Well, I'm asymptomatic," but he wound up getting the antibody therapy. He wound up getting the medication. So if you're not asymptomatic, why you got to go all the precautions? Because you scared. Because you know the threat of this situation. You know it. You sitting up here being around all these people in this daggone party, infecting all these other folks, and then you caught it, and guess what? It got real for you. Your mortality is now on deck. You won't fit. I'm serious. Anti-vaxxers, and look, you do what you want to do. You can do what you want to do. If you don't want to vaccinate yourself, okay, that's cool. That's your decision. As an American, as a person, that's your decision. Okay? Now, when it comes to things about if you're going to anti-vax, I want people to make sure that they're doing it based off of being informed. Not off of social media, not off of just what your friend says, because my friend's doctor's best friend's wife is a nurse. Or my podiatrist, the foot doctor, said that I don't need it. Because whenever I tell people this, whenever a healthcare professional tells you the science, I believe it. But then when they say, but in my opinion, that's where I stop.
Yeah.
The virus is real. The virus is happening. The vaccine has been proven to work.
Yes.
Those are the main things that we need to understand. But us is the Tuskegee experiment. Oh my goodness, the government's out to get us and everything like this. Okay, I can understand your plight when it came to that. But at the same time, how did they cure polio? The entire world had to get vaccinated. And this was around the same time the Tuskegee experiment was going on. Even the children from the Tuskegee experiment spoke out and said about getting the vaccine. We got to get past the superficial aspects. Well, we don't know what's in the vaccine. We don't know what's in it. Go to the CDC website. They give you the ingredients.
Daniel? Because a lot of people have said that. I mean, I've actually been one of those people too, and I just recently got over COVID myself. And prior to getting COVID, I had just got like the first vaccine. And because of me getting the first vaccine, it made COVID a lot easier to deal with. But I always say this to people who are anti-vax and say stuff like, well, we don't know what's in it. If you get shot and you go to the hospital, you're not going to tell that doctor, I don't want to take that pain medicine because I don't know what's in it.
Of course.
You're going to take it.
Of course.
You don't know what's in it, but I bet you're going to take it. What's the difference?
My best argument with that is when they say that they don't know what's in it. Don't eat at McDonald's. Don't go to Burger King. Don't drink that soda. You don't know what's in it.
You don't know what's in it.
You don't know what's in it.
And then when people say they tracking you,
they're tracking you. They're gonna put a chip in you. You have this.
Oh.
I don't know why that,
But
but yeah.
Shut down the show. People are wondering
maybe they're tracking us, and then they want
I
to
know,
get
right?
into the
I know, right?
something.
Illuminati
Yeah,
everywhere.
Right.
They got.
But I'm like,
Look,
you got me? You
we're
got
looking at
phone?
cameras looking at us.
Exactly. And if
don't
you have a
need-
if you have a Google Home or anything, guess what? That sucker listens all the time.
Yep.
So you weren't the government off of a government been tracking you for years. Don't get superstitious and get your tinfoil hat now.
Even before cell phones.
Exactly.
I mean, they send you your taxes every year. They know where you're at.
Exactly. You do a census every. Come on. So here's the thing. I'm like, if you don't know what's in it, go to the website, get the ingredients.
Yep.
Well, I don't understand what all this means. Take it to a doctor. Have them explain to you what it is. Well, the mRNA part of it is going to change your DNA. Not true. Plenty of sources, plenty of information that's been out there to debunk these things. But people are going to be like, but excuses are tools of the incompetent.
Yeah.
You know what I'm saying? Now, if it was something to save you, just like you said, I deal with pain management folks all the time. They just know I need my hydrocodone, I need my tramadol, I need my pain meds. Do they care what the chemical composition of these medications are? Absolutely not. They know what takes away the pain and what doesn't.
Mm-hmm.
But yet these same folks be like, I don't want no vaccine. Why? Because I'm American. Okay, great. So you're going to pick up your medication today or tomorrow.
Mm-hmm.
For that epidural steroid injection, do you know? Well, what's in it? Okay, so it's a corticosteroid. Oh, okay. You don't want to know the chemical composition? No, I'll trust y'all. But the same people who talk bad about the medication, the second that they have to wind up going to the hospital for it, they want the doctors to do everything.
Yeah.
At that time. And there have been too many situations where so many people are like, I want the vaccine now. And the people in the ICU are like, it's too late. We can't give it to you now. We got to wait for this to get out of your system. If you're in the ICU, if you survive it, and then 2 weeks after you're cleared, then you can get it. With anything that you're putting into your body, I always tell you to consult your healthcare professional. Always do it, because pre-existing conditions are always going to be key, and they're always going to be at the forefront of whatever you do.
Yeah.
If changing your eating and health lifestyle, to lose weight or whatever, consult your healthcare professionals. Why? Because you want to do it safely. Always want to do things safely. If you're putting something in your body, do it safely. Research it. There's too much information out there in this day and age in 2021 to be ignorant about what's going on. And there's the difference between ignorance and stupidity. Ignorance is not knowing. Stupidity is knowing and choosing to do it anyway.
Exactly.
Let's not be stupid. Let's be, ignorance we can understand. If you don't know, ask. We'll teach you. We'll give you the information. You make the informed decision based off of you. I'm not going to call you stupid. I'm not going to call you selfish or whatever the case may be. That is your decision. Now, how I respond to your decision is mine. If I don't want to be around you, I don't have to. If I don't want you to come over my home without being vaccinated, that's my choice. You made your choice. I made mine. It's not a us versus them situation. You got to, everybody makes choices and decisions. Ain't nobody coming to my house unless I say so anyway, but I'm going to ask you that extra question. Hey, have you been vaccinated? No? Okay. You can call me on the phone. Why? Because I got 2 small unvaccinated people in my home. That means more to me than life itself. Well, you're overthinking it. Well, guess what? I'm going to overthink it for their safety.
Right.
And that's my choice. Let it happen to you to where you have to go into that situation alone. I know I went the long way around to answer your question, Archie, but let it happen to you in your home to where you have to make those decisions alone with nobody to walk you through it.
Yeah.
And then think about it being on a child who does not understand what's going on, who's going to be in a panic situation even more than you would be.
Yeah.
Unfortunately, for some people, it kind of take that,
It does.
and that's really bad, because it need to be real to you before all of that. But for some people, that's just when it becomes real.
Yeah. When it becomes a real life or death situation, that's when people wake up. That mortality check. That's what it is.
So, Daniel, I have a question. What about the variants, man? These variants just keep on popping up left and right. Actually, when I first met you, we were on a podcast talking about the Lambda variant. So if you could just explain to people like a little bit about the Delta variant, a little bit about the Lambda, like, and the effects that it's coming with. And I think there's even now a new variant that's out right now.
Okay, so you have different variants, just like you have the influenza virus, which is the flu virus, which mutates every year. The vaccines that they have to put out for these things have to be stronger because guess what? When it mutates, it becomes stronger, and that vaccine is not as effective. We had COVID-19, which started last year. Which started last year, and it pretty much ran rapid, over 600,000 deaths in the world. Now, as things change, viruses mutate. Some of the same things that you've been doing to prevent it don't work no more. That's why the vaccine was so key on getting out, because they were looking at the event of this mutating to a point to where your body can't fight it off. With the Delta variant, it makes it more, it's transported by air. It's more concentrated because I think the particulates are 1,000 times stronger in the airways of people, including those who are vaccinated. So, let me make this point. If you are vaccinated, you can still catch it. That's what they call breakout cases. And I'll say this. When you become fully vaccinated, that means dose 1 and dose 2. That don't mean take off your mask and go jump in the mosh pit of God knows what. They had all these concerts recently. Why? And think that you're going to come out clean. There were so many more cases. You can still catch it. And even though that you may not be showing the life-threatening symptoms, you may not suffer from those, you can still be a carrier and still pass it. Yeah. So understand that. So with that being so much more concentrated, the onset of the symptoms were that much more pronounced, to where the effects of it could be more detrimental to the body. A lot of times pneumonia was also a key factor. And if you have those pre-existing conditions, high blood pressure, diabetes, congestive heart failure, cancer, all of these different types of things that leave your body in an area of being immunocompromised, then that makes you more susceptible to these variants. So COVID-19 was bad enough. Now it's on steroids. And then the Lambda variant is that on steroids times 20. It's mutating. Now, as long as we still have people, the vaccine is to help slow the spread, so that way, one, we can build up our immune systems to fight it and keep it managed.
Yeah,
we don't know how long it's going to be here. People are like, oh, well, we'll probably be good next year. That's what they said last year.
Yeah,
it changed so much, and it happened in March. They're like, in Texas, they're like, oh, well, summer's coming. Heat's going to kill the COVID, as all the country folks in East Texas say. Like, no. Who told you that? What Magic School Bus episode did you think you got that from? No, it didn't kill it. It's not more aggressive in the summer than it is the winter. COVID is COVID. You know what I'm saying? Now that school is back in, you're seeing how strong it's impacting. Schools are shutting down. Had an employee, her child was in daycare, and they had to shut down the daycare because there was an outbreak. The state had to get involved and shut down multiple daycares because an outbreak had happened. It's mutating at a fast rate. As long as people are still out there doing their thing and thinking that it's not doing it, even if you're asymptomatic, guess what? You're probably giving it to somebody else. And it's incubating, mutating, and coming out. It's to a point to where and this is just me. Okay, look, I'm an EMT basic. You can take whatever information that you get from me and run with it however you want to for all your listeners. Okay, we're almost to plague territory.
Yeah,
we're almost to plague territory. Texas, as y'all probably already heard, has already started ordering those refrigerated trailers again. Because what are we expecting? Mass deaths. Because guess what? We don't have room in the hospitals to where they're telling folks, you know, you may not have heart surgery, you may not have this because we can't do those types of surgeries. And if you have COVID and it's, you know, we have to turn you away because we have no room.
Yeah.
Hell, even the urgent cares can't even keep them for long. So where they have to start making them harsh decisions. If we don't have no room, where can we send you? Can't send you to Dallas. Dallas is full. We'll probably have to send you out of state. Now think about it. You can't even be local. You have to go out of state. In some instances, you can't go to Louisiana. Louisiana is just massively packed, and then they just had a hurricane, so all those folks down there are being diverted elsewhere, which puts even more strain on the healthcare system.
Yeah,
nurses and doctors are quitting. Some doctors and some hospitals are saying if you're not been vaccinated, you can't come in to be treated. Why? Because you're a potential super spreader event to all these sick people who are already here. Think about it. We're almost the plague territory. Once the plague territory hits, then all of a sudden the deaths start spiking. Well, the deaths aren't that big when you, and I told somebody this last year, whenever the deaths start to multiply and multiply fast, then it's too late. It's too late. Now you're trying to play catch up with death. You don't need to play catch up. Stay ahead of it the best way you can. First steps first, masks. I think I got one in here. Yep. I got them in here. I keep them. These right here, as you can tell by the colorful print, are not for me. They're for my children. Good old N95s. And I have a couple of cloth ones. I don't really use these because if you can blow through it and blow out a candle or blow out a match, it ain't doing you no favors. But I keep PPE on me.
Yeah.
You know, it's more, I'm serious. I always check two things before I leave the house: my wallet and my mask. Half the time I can go anywhere else without my wallet and be like, okay, well, heck, I made it to work. Oops. Well, I got my mask though. I ain't playing with that. Mm-hmm. You know, wallet I can go get. A mask, if you ain't in the right place, you're gonna have to go look for it. And I'm not about to go anywhere without one. I'll go home and be late for work to go get my mask. Even if they say, oh, well, Daniel, we have masks in here, but I got to walk in that joker and go get one. Without one, nope, I'm not playing. Yeah. No, Healthcare fields, they're little petri dishes. The same as elementary schools and high schools, petri dishes. You know, it gets to a point to where, and it's just maybe me, to where it's like, you know, where's a safe place for us to go? You know, outside other than a park for my kids to play at, socially distanced from other children. And if other children decide to come around, we have our kids put their masks on. Why? Because we don't know. And they're under 12. I know they're not vaccinated. Yeah. So you're like, where is the safe location? There is no safe location now. So you have to start moving in a sense of caution at all times. You know, where I live at, there would just so happen to be EMS that pulled up in my complex, and I would just so happen to walk. As soon as I saw them walk close to where I lived at, I went right back into my car, grabbed my mask, and walked upstairs. Ear hustling, shortness of breath, fever, and chills. I'm like, God, dog, that close. It's enabling. To where now we're having to walk outside of our apartment with masks on because we don't know who we may walk by. And it just may be paranoid, whatever to me. And people tell me all the time, well, you just got to put it in God's hands. Okay, that if that works for you, there are too many saved folks not following common sense out here. You know, for those who follow the Bible, you know, what happened when Moses said to Pharaoh that God will come down with the plagues. What was the last plague? The angel of death, right? They had to mark the doors with the lamb's blood. And what did they say? Do not come outside. Yeah. Because if you do, your firstborn sons will what? Surely die. Yeah. As a lesson to follow directions, because I'm going to send a plague.
Plague territory.
Hello?
Yeah.
it may get to the point to where literally we go back on a shutdown to where they say do not come back outside, but they don't want to do that to be safe because of money.
Exactly.
Commerce has to run, businesses has to go. Oh, so many businesses shut down and everything. But you know what Americans learned last year due to the shutdown? We don't need to buy as much consumer products as we need to.
Mm-hmm.
We actually invested and saved a lot of our money on stuff instead of spending our money on stupid stuff. Families got closer. Those who didn't know how to cook, sure enough, learned how to cook by using the almighty YouTube. And it helped improve the family dynamic. Now, given for those who had family issues, it did raise the rate of domestic violence because I did respond to those calls too. But for the most part of it, it did help. And what happened to the numbers? They plummeted. New Zealand had one case recently and shut the whole country down. They said, nope, we got one case. That's too many. The other countries now look at us and put any Americans on the do not fly zone. Why? Because our numbers are the worst in the world. The world. At one point, Georgia had more cases than most big countries in the world. Wow. But that's just common sense ain't so common nowadays. We got to do the things. I'm like, in order to do the things that you need to do to have the life, to get life back to normal the way that we need it to be, we have to get rid of something. People don't want to get rid of anything. Oh, I got to go to the movies. I got to go to the club. I got to go do this. Okay. Get sick and let's find out. Well, if I get sick and die, it was my time to go. All right. If you're comfortable with that, that's fine. I want to see my kids grow up.
Yeah.
Daniel, we have a question from Chase West in the comment section. You just said that we have the most would you say COVID deaths or yeah. COVID COVID infections. Is that per capita or is that just in total?
In total.
Oh wow.
Now if you want to go in concentrations, now you can look at Louisiana. Louisiana is heavily condensed as far as COVID cases. Same thing with Georgia, Mississippi, Tennessee, and of course, everything is bigger in Texas, right?
Yeah.
Now, when everything happened with this Delta variant, yes, it got really, really big. But what happened with a lot of it? A lot of the people started to get vaccinated. Now, it showed that. Now, this is per news, MSNBC, CNN, and all. And I don't really watch Fox. Y'all know why. But anyway. Most of our country was at 20% or less with vaccinations. This was 2-3 months ago. I checked our vaccination area in East Texas, well, at least most of the areas in East Texas, and we're barely getting up to maybe 43 to 46%. Wow. At least with one shot. Think about that. 3 months to get us to about 46%. We're not even halfway there in most counties in East Texas. And that's because these folks ain't got nowhere to go for the hospital. Now, I'll give it this. With everything being so concentrated with all these COVID cases and infections, now these are mainly the infections that have been reported. Okay? These are the ones for people who have taken the test and have confirmed cases of COVID. There are so many people who cannot go to the doctor, who have not been to the doctor, who are infected, asymptomatic or symptomatic. So you have to kind of take that. There's a buffer area for that as well. All right. But as far as in total, we're the number one spot.
Yeah.
Countries won't let us go out. A lot of the times they won't let us come to the country without having I think it's a rapid test, 24 hours, and a PCR within 48 hours.
And then you have to be vaccinated.
And then even more so, one of my other good friends who travels a lot, she's like, okay, and as soon as you come to the country, you have to be double masked. If you're on an airplane, you got to be double masked. When you come into public area, condensed enclosed areas, you got to be double masked. And there are people there to enforce you having two of them on. Now think about it. These are precautions that other countries are taking. Why? Because they care about their people and don't want to be like the U.S. right now. Why can't we do that? We can, but nobody wants to give up anything. Nobody wants to put in the extra amount of funding that it takes to make things. Now, thankfully, the war in Afghanistan is over, so that's $1 trillion that we get to keep at home and probably resource that to the areas that we need to.
Yeah.
But what are people willing to give up so that way they can keep their family safe? What luxuries are you willing to give up? Mine is going out. Me and my kids will take a walk in areas. We keep our masks in our pockets, and we go out for walks. We do little fun things. My kids are homeschooled, so we do a lot of events and projects and stuff at home. But we take them out, and we are extremely watchful of what's around and what's going around. People start getting busy, and people start crowding the area. By the time I go to look at my wife, she's already looking at me like, "Yep, time to go."
Yeah, time to go.
Yeah. Family members. My mother-in-law was like, "Can't nobody come over our house unless you're fully vaccinated." No problem with me. They were very, very protective over us and our kids. Same thing with my folks. Very, very protective of us and our kids. But that's just the thing. But when I went to go get my vaccine, I was fully vaccinated back in February. And when I went to go get my second dose, guess who was there? Guess what demographic of people were there?
Young people?
No.
White people.
Oh, white folks.
Oh.
And I'm talking about there were lots of them. I was the only speck of pepper in that room for about a good 20 minutes. But that's just but that lets you know something. They understand, and they're like, I'm not taking any chances. I'm going to go ahead and get it. Now, this was back in February. Yeah, February of this year.
Mm-hmm.
We can have folks stand in line for concerts, stand in line for football games, stand in line for shoes. I don't know why people do that. I don't know. Stand in line for things that that mean nothing to them for the long run until they have to go do something else again. But they will not take the time to take care of their health. But want to blame it on the government, want to blame it on them. I'm like, your health is in your complete control. If you wanted to go outside of the country, you'd have to get vaccines. If you want to go to the motherland of Africa, you'd have to get vaccinated. Yeah. If your child wanted to stay on college campus, they had to get vaccinated. Yeah. Including that meningitis one. You'd have to. There's no complaints when it comes to these. Why is it all of a sudden a complaint when it comes to this? When it's been proven to work. Remove your personal feelings out of the situation and understand the benefits of it by the science. And take and do what you need to do. Of course, consult your healthcare professionals to make sure that you're doing it safely. But do it.
So Daniel, you talked about, we're in plague territory, and we keep seeing this yo-yo effect. Like, it'll get super bad. We'll almost lock down. We'll put a lot of restrictions on. How long can we continue this yo-yo effect until things just get out of control?
Things are out of control now, but nobody wants to admit it. Mm-hmm. If things were in control, you see the yo-yo effect like this only because public perception is making it do that. The powers that be are moving things around so that way. Oh, well, the numbers dropped slightly. Oh, well, we had a couple of few, hospitalizations. Okay, that's great. But guess what? The hospitals are still full. So what? So many people didn't get admitted because there wasn't any room. Read between the lines. We're not okay. Yeah. And it's okay, United States, to say we're not okay. Stop lying to people trying to get the perception of we're okay so that way, one, you can continue to get your votes. And so that way your money from your supporters keeps coming through. That's the issue, the big issue of what we have in Texas. You got people who are sitting up here going and getting hospitalized, Republicans all the way. But then all of a sudden they'll fight it. Oh, well, it's not that bad. I fought it. Well, people are not. People are dying. They're not reporting it like they did last year. Because last year they didn't have a vaccine. Because that's the only thing that we can do outside of everything else is watch people die. And that's the worst thing. We had over 600,000 deaths. Well, that's not as bad as this disease and this disease and everything. Okay, tell it to those family members.
Right.
I have a good friend who's not celebrating, but who's commemorating 1 year of her husband passing away last year. A good friend and fraternity brother, and my other frat brother, who was my big brother, and both of them were good friends of mine, sat in the room across the hall from him while they were both in the hospital with COVID. And he struggles with that. Sometimes feels like that should have been me. I made it, and my best friend didn't. And then I'm like, it always seems like it's the ones who are the best ones that seem to go.
Yeah.
And they go fast. If you have a pre-existing condition, it can go fast. It can go real fast. You can decline extremely fast. But I'm like, we're not okay. We got to stop trying to do these big old events and try to do all this. Oh, well, social distancing is encouraged. People ain't going to do it. They're worse than kids. And kids can't keep their hands off their face in elementary school anyway. And we got grown folks who are worse than that. The second that we start acting like this is something serious and start taking the precautions and being serious about this is the second that we can actually start to get a hand over it. But I feel like the people in Washington and everywhere in local government, everything, are playing too many politics with this, trying to keep people happy and not panicking. Yeah. Because people can panic. If they were to tell you the truth about the whole thing, they're trying to keep people from panicking. Mm-hmm. But the people who have family members in the hospital, who are burying family members, and all this other stuff like that, who have family members who are sick, they're the ones who are like, please. If the ones who can't get the help, they're like, can we get some help? We know we just need something. We got it. We're not okay, and we're not going to be okay for quite some time. The quicker that people get this understanding and stop playing with it, the quicker we can start to make a change for things for everybody.
Yeah. Yeah.
How do you feel about people taking ivermectin? And because Joe Rogan just recently he got COVID, and a lot of people are saying he took the ivermectin, but people aren't talking about how he took the antibodies, the Regeneron shot, the real thing that got him over COVID. But how do you feel about people taking ivermectin, the horse dewormer?
People get desperate when they start when I was about to cuss, when the ish hits the fan. You see what I'm saying?
Yeah.
Oh, I'm an anti-vax and everything like this. I got COVID. I can't breathe. Give me everything. Give me the horse tranquilizer. Give me something. Give me something that's for eels. Give me something that's for jellyfish. I heard about it. Just give it to me. All of a sudden, when your mortality is on the table, you're more than willing to try anything to save your life, because now all of a sudden you got something to lose. And they're desperate. Come on, what was it last year? Hydroxychloroquine?
Yeah.
President Cheeto Puffs was just sitting up there last year talking about promoting hydroxychloroquine all the daggum time, and guess what? It didn't do nothing.
Yeah.
President Cheeto.
It's the same stuff. Why would you put something that goes into an animal that weighs 10 times more than you, thinking it's going to be okay for your body? Because you're desperate.
Mm-hmm.
And you're stupid. At that point, you're stupid, because common sense would have told you this is not made for human consumption or for human use. It says it. So why would you do it? You're desperate, and you're listening to other people who are desperate. And guess what? Those people who are telling you to go ahead and take it probably don't care about your life. No way. That's one less person to them gone. You think that they care? No, for a fact they can hurt you? No, but they're working off of your fear to meet an end. Yeah, it's stupid. Oh boy got scared. Their mortality got checked real quick, and people need to actually do more studying than reacting.
Yeah,
he's a person that reacted, because guess what? He got the Regeneron too, right?
Mm-hmm.
How many people are not fortunate to get that?
Exactly.
It's funny how all these people who got money, politicians, the second that they catch it, oh, give me the antibodies, give me the Regeneron. Why? Because you have access to it, while your constituents suffer and die.
Exactly.
Thank you. Yes. Absolutely. That's what happens.
But yet, these same folks will go out there and they'll vote for them, knowing for a fact they wouldn't do anything to stop what they're doing to save them. When they're obligated to, actually. You're really obligated to. So that lets you know the dedication of those particular elected officials, right?
Yep.
Is it about the vote or is it about you? But they're trying to get the Republicans have been trying to get all their people to get vaccinated. Why? Because they're the ones that are dying. They're the ones that are in the hospital. You won't make it to election if all of your constituents are dead.
Exactly.
Between the lines, man, it's not hard. Read the facts for what they are. Take your emotion out of it. It's right there. It's right there.
Yeah.
They do not care about you. They care about your vote.
That's it.
They care about your vote.
Yep, keeping themselves in power, man. And it's funny because, you know, Republicans are now making this big push for their constituents to get the vaccine because they are the ones who are the anti-vaxxers. They are the ones who are dying. Yeah. And like you said, if my constituents are dead, how am I going to get reelected? How am I going to possibly get back in office?
Exactly.
Because you're not getting the young people, you're not getting the blacks or the Hispanics. So how are you going to get in office? You're not. And it's so sad because, you know, people hold on to like people like Tucker Carlson, you know, just so many other right wingers who just spout nothing but nonsense and falsehoods, and you know. When these people, they have access to the Regeneron shot, they even get the vaccine, exactly. And that's the most disingenuous part. They'll have the vaccine and then be like, well, you know, I don't know, but you know, even Trump in his own rally said, "I got the vaccine," and they booed him.
Yeah,
how big of fools are you?
Come on, man! It's the Kool-Aid. They didn't all drink it.
Yep, exactly.
It's cognitive. What's the term? Cognitive dissonance.
Yes.
They believe something so much to where when facts are introduced, they reject it. This is the same person who used Operation Warp Speed. Come on, Star Trek.
Exactly.
To get the vaccine situated first, this man caught it. Was actually got all the top perks and everything. Recovered from it. Him and his whole family got vaccinated, and the man tells you, "Go get vaccinated," and then they boo him. They're like, "Yeah, boo, you're an idiot." He's like, "You do know you have a vaccine because of me, right?" And they're like, "No, boo, America, Trump 2020." He's like, "But this is." You know how he does the hands.
Yeah. He's like, "This is me. This is my accomplishment." Yeah,
I'm like, how far gone do you have to be to not even follow your own cult leader when he tells you to get vaccinated?
The Kool-Aid is deeper. It's gone past. You know, the Republican Party has become something of a monster that no one can control. It is Frankenstein out on the loose. And we just see the monster just destroying and terrorizing stuff. I mean, especially down here in Texas, the things that you know, all the things that they've passed, you know, just the COVID stuff that they're doing. Hell, the stuff that they're doing to children. What, you know, kids want to wear masks. Kids don't really have a problem wearing masks. These are these crazy parents, backwards parents who are like, you know, it stops the kids from talking and speaking. Like, kids can speak through a mask. People can speak through a mask. Like, surgeons and doctors have been wearing masks for hundreds of years, talking to each other, doing surgeries. It's just these excuses that they come up with. It's just really just ass backwards, and you can deflate them right there, right then and there. It doesn't matter.
Right. My kids got masks on, and they talked my ear off in Walmart earlier today. Exactly. I'm talking about talking my ear off. I have to tell my son, "Hey, man, fix your nose. You know, make sure it goes up, because when they start going, they start going." They underestimate children. They underestimate children's resilience. They underestimate children's intelligence. They really do. Children see that. My daughter, when was researching it herself off of YouTube Kids, they had kid videos talking about COVID. To where she was coming to me, "Hey, Daddy, this is what it does? Is this what the coronavirus does?" And I was like, "Yep. I don't want that. I don't want to get sick. I don't want to do that. Does that mean that we have to go back to school and kids are going back to school? What if the kids get sick? What if I get sick?" This is my daughter. I'm not prompting her to do none of that. That's what she was telling me because she did, as a child, did the research to understand the severity of the situation. To where we went to the park one time and my daughter had a mask on and her friend was running up to her. "Hey," my daughter was like, No. I can't hug you.
It's like, back.
This month. And the parents looked at us like we were crazy. I'm like, sorry. I can't hug on you. I'll fist bump you. Wakanda forever. If you get offended by that, I'm sorry. No, you don't want to play? Okay, cool. We got something else to do. And just keep it moving.
Yeah.
It's a task. It's a task. But it's doable. It's doable.
If people get the right mindset, it is doable.
True.
But that's the problem. Everybody don't have the right mindset about this situation.
Because they don't want to give up anything.
That, and then some people actually still don't believe that COVID is real.
Oh. Okay then.
That's the craziest part.
Oh yeah, I'm serious. I've had people call it the China virus. I'm like, you do know the Delta variant originated here, right? Regardless of where you think it came from, or what government conspiracy that you want to attach to it, it's real. The people who have died. Oh, those numbers are wrong. Okay, cool. Okay, if the numbers are wrong, what is your source? What is your resource to prove it? Yeah. Well, I heard. What's your source? I don't have one. Okay, then. So stop parroting stuff. Stop it. You're grown. We're not playing telephone. You got a computer in your hand. You got a computer in your face. For those who play PlayStation and games, guess what? They have a web browser. You have no excuse not to educate yourself about this. If it was fake, why is the world talking about it?
Why are people dying from it?
Still dying from it.
Left and right.
I just had someone close to me die a couple weeks ago.
I just had a good friend of mine. His mother just passed away this past Thursday. Wow. After he had it.
We just had a friend of the family pass away. That's what I'm saying. 3 different people affected by it.
Yeah.
But then people will say it's not real, or it's or it's some. I hear so many crazy things. It doesn't even make sense half the time
because it hasn't hit their home.
Yes, yeah.
It won't mean nothing until it hit it. We could talk about car accident statistics. We could talk about drunk driving. We could talk about the heroin the opiate epidemic. It won't mean nothing to nobody until it hits home.
Mm-hmm.
Then you'll look at life differently.
Yeah.
Then you'll look at life differently until it actually hits you. Or I've had people argue it up and down. I just had somebody die from COVID. Are you sure it was COVID? Yes, I saw the positive test. Well, they're lying about that. Did he have any other underlying health issues? No. Well, it's just, look, you can sit up here and try to find a scapegoat in a situation. It is what it is. Well, hospitals are making a whole bunch of money off of it. Well, you know what? I don't see.
So what?
Death is not something to profit from. Death is not something to be happy about. Pandemic death is really not something to be happy about, because guess what? You can't choose who gets to live or die.
Yeah.
And you don't know who may be hit next. Hell, if I make the wrong move, it could be me. It could hit me again tomorrow.
Yeah.
It could. You got to take all of the necessary precautions. And when I use the crazy analogy, and I'm sorry for being graphic, I'll PG-13 this as much as I can. So imagine you're standing outside, you and your friend, best friend there, and you decide to pee. You don't have pants on, so your pee gets on the other person's leg. If you pull your pants up, pull your underwear on, guess what? If you pee, it stays in your underwear, right? And it doesn't get on anybody else. So if you both have your pants on and underwear on, if you urinate, guess what? It stays on you. Wear a mask. If you sneeze, it's not 100% particulate compliant, but it's a preventative barrier.
Yeah.
It's a preventative barrier to help protect you and protect someone else. And this is the thing that gets me when I hear people, when I see people talk, and I'm just gonna put this on just for this is what gets me when I see people do this. When they put the mask on, can y'all still hear me?
Yeah.
They're like, "Hey man, how you doing?" And then all of a sudden they say, "Huh? Why you pull your mask off your face?"
What?
Yeah, bro, just wait.
I've seen people do it. That's
I've seen people do it. I've seen people do it.
Hey, what's up, homie? You doing all right? Huh? Your ears are here.
Here.
What you gotta do? Look,
Yeah, that's
I've had patients tell me, "Hey, can you take your mask off?" I know I can project louder. You're vaccinated, right? Absolutely. Well, you can take it off, but I don't know you. Well, I'm vaccinated. You can still be carrying.
Yeah.
I'm not talking about September 1st. We can carry weapons and stuff. I'm talking about you could be carrying. I'm not gonna play with you. Why? Because I don't trust you. Why? Because my life and the life of my family is not worth you. You may be a fantastic person. You may be a fantastic friend of mine, but my life and the health of my family is not worth you. I'm responsible for them. I am. Yeah. However else anybody else may decide to move, that's how you move. I can't fault you for that. Only thing I can do is control my space the best way that I can. And I hate that people are saying, well, it's, the vaccinated against the non-vaccinated. No, it's about levels of responsibility and what people find important to them.
Yeah.
You just don't want to get because, well, I've heard this and based off of this. Okay, well, that's your informed decision. Now, if you start trying to make me feel bad because I got vaccinated, okay, if my words are rated E for everybody, and I'll go ahead and I'll tell you about yourself based off of facts and experience.
Yeah.
It's just the things that you have to do, the precautions that you have to take. It's a responsibility issue. Like I told you, Archie, it ain't gonna matter to them until it hits home. And hopefully
unfortunately for some, by the time it hits home, it's too late.
And that's what I was about to say. It may be too late by that time. Yep. Then you have to watch that person go off to be alone and try to fight it, or you have to be that person to go along and try to fight it. Yeah. When I felt bad, I couldn't move for at least a day and a half. I just couldn't move. And I'm like, if I were to go or be in a situation, my family's out there, they probably wouldn't even know I went.
Yeah.
Think about that for the elderly who live alone. Or for a child. That's terrifying. And it may not matter to other people, but it matters to me.
Yeah.
I try to educate everybody who I can about it, give them my information. If I don't know something, I will print it out and I will give it to you.
Yeah.
Research it. I don't know what this says. Well, here, I know some doctors who are smarter than me. You can either message them on social media or you can call your primary care and ask them.
Yeah.
Ask them to break down the science to you. Take your person and I always ask them, tell them to leave their personal feelings out of it. Because guess what? Even though that doctor is maybe a great and fantastic person, that doctor can miss a day of work. A lot of people who I know live, like including myself, live paycheck to paycheck. We cannot miss a day of work. A couple hours for some people. We can't miss that because that throws a whole wrench into our financial situation.
Mm-hmm.
And if you're coming from a single income situation, That's devastating to a family. That's why when a lot of times when, I talk to some people and they give me their personal opinion, I'm like, okay, cool. So if you miss a day of work, how does that affect you? Well, it really doesn't affect me. Well, it does me. So your personal opinions really don't matter in this situation. I do it because I'm asking for me.
Yeah.
Now, if you can miss work, by all means, power to you. I'll put my Cash App out there. If you want to pay me $20, I will most likely take that donation because you good. Share the wealth because I ain't there yet. But, you just have to remove the emotion. Remove the emotion. Trust the science, trust the research. Your gut is going to tell you what's right. Your gut will. If not, look at your children's eyes. If you don't want to protect yourself, protect them. It's not that hard of a choice.
Yeah, man. To me, like you just said, bro, you have to take it upon yourself, and you have to do what's right, and you have to protect yourself and your family, and you have to do that any way possible. And that's why we do these shows. So if people have questions, if we try and get this information out about COVID, because there's so many people who don't know about COVID, and we have to get this information out, because if you don't get this information out, people will continue to believe the nonsense they see online, and we will never get back to normal. And I think that's what people want. People want to get back to normal, and that's why a lot of people got the vaccine, because people were scared. People didn't know, but that was a dice that they were willing to roll, and and that's a good dice. So it's just, what are you willing to do to try and get back to normal, to help your family, to help yourself? Because if you catch COVID and you're gone, then you can't provide for your family. You can't be there for your family if you're dead from COVID. So that's another thing people need to think about.
There was one Republican, I think he was a non-vaxxer. He organized something big in Texas about not vaccinating, not wearing masks and all that other stuff. He just died recently from the virus.
I mean, so many. I remember when Herman Cain passed away due to COVID.
Yeah,
that was last year.
And Cheeto King and Chief didn't bat one eye,
didn't bat a single eye,
and just went on. But it's like I was saying about the guy that just recently passed away, anti-vaccine, anti-mask.
Is that the guy with the two daughters that left behind?
Yes, and the baby on the way.
Yeah, I seen you.
You got a widow and two children and a baby on the way to fend for themselves. I got too much to lose, man.
Yeah.
I'm not the richest man in the world by far. I don't plan to be a millionaire or nothing like that. I just want to live comfortably in my life, to be able to take care of my family, do the things that we need to do, and be able to leave a legacy. But I want to be there for it.
Yeah.
I want to have a hand in it. I don't want to be taken out of this world prematurely when I have the ability to prevent the worst from happening at that time.
Yeah.
EMS, doctors, nurses, they hear in some instances, and they say, oh, well, they save lives all the time. Yeah. But even more so, they prevent death at that moment. We're all guaranteed to die. We prevent death at that moment. So just take that into consideration. Those in healthcare, they have a huge burden to bear. It's heavy. They don't get enough appreciation for it. And I'm going to speak for the EMS side, if I could, for a minute.
Go ahead, man.
Nurses get a lot of love, and I'm not going to discount nurses. Like I said before, I'm not going to discount nurses. I'm not going to discount doctors. They do a hell of a job. I can say that personally from seeing them pre my sister, and then I can have a huge appreciation for them, even more so because they got a chance to save my sister from dying at that time. I'm more than thankful for every aspect that they do and the services that they provide. I'm truly grateful for that. But one group of individuals who do not get an iota of that are EMS, EMTs, advanced EMTs, and paramedics. I made as an EMT a little bit, probably almost about the same that somebody at McDonald's makes. I was about 13, 11 an hour that I made in private service EMS. The real money is out there if you get attached to the fire department, because then that's like 45,000 starting off, depending on where you work. But EMS, I barely made 30,000 a year.
Wow.
Working 90-something plus hours every pay period. Having certifications out the wazoo and barely getting paid more than somebody who works at McDonald's. Have to go out there for 12 to 15 hours a day to see the horrors. Oh, well, you're just an ambulance driver. I'm a human U-Haul. I go to the scenes of the accidents to see the people at their worst moment in their life. Either a car accident, gunshot wounds, drugs, mental health situations that the police oh my gosh, get Blue Lives Matter BS. And I'm sorry. No, I'm not. I'm not. They get a lot of love because they're like, do you back the blue? Hell, do you back us? Because when it's a situation where y'all can't handle it, guess what? Y'all leave us alone to deal with it. And we don't get compensated. We don't get paid. EMS has a high divorce rate, high suicide rate, because of the stuff that we see, that we have to deal with, that we have to internalize. And then by the time we take that one patient off that we just had to work on, blood everywhere and everything like that, we clean it up in the back, get everything restocked, and guess what? Off to the next one. And then we got to go home and be dad, go home and be husband. Because I couldn't talk about the things that I experienced at work to my wife. Why? Because they were dark. They were horrible. Some of the times I had to call my wife right after I had a call and I was bawling on the phone because the situation was so horrible that I couldn't take it. And then by the time I said, I gotta go, hung up, came out the bathroom, cleared my face up, and then my partner was like, you good? I said, nope. He says, I know, me either. Time to go. We don't get the love. And when the pandemic first came out to where they had that essential workers getting those health benefits, those extra benefits, EMS was not included at first. We're pre-hospital care. We bring them to you so that way you can work on. You see what I'm saying? We're pre-hospital care. There's a whole bunch that we do that we don't get thanked for. And a thank you for your service or a free meal, pizza, whatever the case may be. Yeah, that's good for the moment. But God dang, a lot of these folks who can do it and finance it, a lot of them are single or on their second or third marriage or work with somebody who's in healthcare that deals with the same stuff. So that way, one, they have a balanced life. But that's just the thing. That's just the cards that you're dealt. EMS needs a lot more backup, a lot more support. You know, at that time when I was working, I got calls for contract work. Come to Dallas, get paid $25 or $28 an hour. Because why? They were overrun. They didn't have enough people. We had to help out a whole city because that whole city's EMS service was out with COVID. The whole EMS service was out. So we had to allocate our services to go help them cover their areas. No extra pay. No raise. We work tireless hours, and I commend all my friends who are still out there. I commend all of them. I wish, and there was never, hold on a second, you had a comment. Because you got vaccinated doesn't mean you'll live to see your children grow up. That's actually in the hand of God. Okay, so I need to answer this comment. right here. First and foremost, I'm not a Christian, so let me go ahead and get that point across. I know for a fact that any moment, at any given time, at any part of the day, my life can be taken. I can either die from something, I can do all this, and my life can go at any moment. Life is not guaranteed past tomorrow, past today. Anybody who wakes up and is above ground is an opportunity to change and impact somebody's life. Too much focus and too much resilience and relying on the divine to protect you without you actually doing the responsible task to protect yourself and others is irresponsible, and it's stupid. Jesus can be the life all you want to, but he also did teach you to have a sound mind and common sense to do the things that you need to do to take care and love your fellow man. So let's get that point across. He did say, I'm the way, the truth, and the light. No other man shall come. See, I was a Christian. I knew all of that. But he also did talk about in the Bible about being responsible to love and to take care of your neighbor as if they're your own. So the vaccine is part of that responsibility to take care of yourself and to take care of other people.
Let me say this. My pastor would always say that, you have faith in God. Of course, you want to have faith in God because God can do anything. At the same time, I agree with you with what you just said because God don't let us be foolish. So my pastor would say anytime, God give us common sense. And common sense says that we need to get vaccinated to protect ourselves, wear a mask and all of that. Then that's what we need to do. Because when you, at the same time, a lot of people try and they test God. And you shouldn't test God and say, well, I'm a Christian, so I don't have to do this. I don't have to do that because that's not how it works. And with all that being said, I don't have to tell you I'm a Christian. I'm also a minister.
Right.
And I have faith in God. I know what God can do, but God gave me sense too. God led me to go ahead and get the vaccine. God led me to, every time I leave the house, I got a mask on. And now after having COVID, I want to have on gloves too.
Right, but you want to make sure that one, you have another opportunity to testify and to give your experience.
Yeah, because listen, wearing the mask, getting vaccinated does not mean that I don't have faith that God can heal me. But God gave me common sense, so I use what God gave me. Take the common sense actions, and then let my faith work along with that. Because there's people who there's some people who can get vaccinated and still actually pass away because they don't have faith or whatever. I got vaccinated and caught COVID after getting vaccinated. And I believe that God led me to get the shot because I wasn't going to get the shot, and I just so happened to get the shot, man. Like, what was it, Gion? Like 2 weeks before
it was like 3 weeks, almost 4 weeks, because it was almost time for you to get your second vaccine.
Absolutely, yeah. In fact, I got when I knew I had COVID, it was only like I think 2 or 3 days before I was supposed to go and get my second vaccine, and I believe that God would heal me from it, but I also believe that it was God that led me to get that vaccine. And had I not gotten it, who knows? I may not be here right now.
Yeah. And and let me clarify what I said. For those who just rely on it and rely on it alone without doing anything, because I've had many people who've been in the back of the box with the faith saying, I know he's going to heal me from it. I know he's going to do all this. And they didn't take the precautions. And they say, they're gone. I'm transporting them to hospice.
Right.
Yeah. That right there, being in that realm, really, really tested my faith at that time. There was just so much going on. The Black Lives Matter thing, the protests, the police shootings, and all that other stuff. I was in the thick of all of that. To where one, I was being challenged by everybody on who I supported.
Yeah.
Because if I supported the Blue Lives movement, then it meant that I turned my back on my own people. But if I back my own people, then it means that I turn my back on them, and we all in the same field. I had people, just police officers and doctors, just came up to me asking me, well, what do I support? What do I think about this that happened? To where it just had me draw a very, very conscious line, between people who all supposedly worship the same God, to deem others who do not look like them as less than or unworthy. And I did a lot of searching within myself. I've been in the church since my youth. When I've always questioned things, if you can't tell. I always question anything and everything that's brought in front of me. I don't ever take anything at face value because I just don't trust it. I always make sure that I do the research that I can to protect myself the best way that I can. To make sure that, one, if I'm going to regurgitate or say something to somebody else, even when I was in a church, I knew what I was saying. And then I tell people the same way one of my friends who's a minister told me, don't believe me, read the book.
Yeah.
Same way when it comes to the vaccinations in this pandemic. Don't believe me. Read the information, do the research, make the informed decision on yourself.
Yeah.
But when it came down to that, I can't. That right there was hard. It was a huge axe for me to grind when it came to that faith aspect and faith alone that a lot of people, unfortunately, are relying on.
Yeah.
And which is not boding well for them now. That's the only thing. It's great to have the faith in a higher power or whatever. But if the science and the foundation that is there, trust the science and the foundation. Don't just trust the faith alone.
I think Chase West said something really great. He says, getting the vaccine and wearing a mask is a lot like being a Christian. If I'm wrong, no big deal. I'm mildly inconvenienced. If I'm right, I have the ability to save so many others from a horrible fate. And I think I think that really hits the nail on the head. For the people who don't believe in the coronavirus or the vaccine, just by wearing a mask and, maybe even getting vaccinated, if you know someone who's gotten vaccinated and, they haven't had any, bad side effects or, it wasn't a breakthrough case, then, just go ahead and do it. The biggest thing that can happen is it's a minor inconvenience.
Mm-hmm. It's better to have it and not need it than need it and not have it.
Have it, exactly.
Hey, didn't I just tell you that before we got started?
Yep.
That's my motto, man. So, man, it was a lot said. And people need to take heed. People who are watching, people who may watch this video later.
If you're watching this, don't forget to like, comment, and subscribe, and share the video out to so everybody can get this. Everybody needs to hear this information.
Yeah, this is like that video, like I mentioned earlier, that they show in school of all those car accidents and stuff, to give you a forewarning of what could happen if you don't take the necessary precautions and do things the right way. And part of doing things the right way right now is protecting yourself, protecting your family, protecting other people around you. And if you don't want to get vaccinated, like Daniel said, if you don't want to get vaccinated, that's fine. It's your choice. But have some responsibility. Show some responsibility, and protect the people around you from you, or try to protect you from them. Wear your mask. I mean, that's not that much to ask. Wear a mask, because everybody can see the numbers are spiking with COVID. Everybody can see people are dying left and right. So make no mistake that it is COVID is real, and so that means that everybody needs to do what they need to do. Do your due diligence and practice the safety precautions. Stop playing games, because COVID is not playing games with nobody.
Mm-mm.
COVID is serious, and so in order to beat COVID, we have to be serious. Exactly. And stop playing these games with our health and with other people's health.
Yeah, and if you don't want to, get the vaccine, and if you don't want to wear your mask, then just just stay your butt at home. I mean, that's like
nowhere.
the next. Just don't go nowhere. I mean, you can get food delivered. You can get your groceries delivered. We use Amazon for basically everything. You know, who wants to? I mean, honestly, I try not to leave the comforts of my home because it's just too dangerous out there between COVID, the cops. You know, I just don't have time for that. You know, I'm trying to live a long, successful life, and no, I'm not fearful. But you know, while we're in the middle of a pandemic, I will act and treat it like we're in the middle of a pandemic. I'm not gonna.
Common sense.
Yeah, just common sense, like we've just been talking about. That's all it is.
Yeah.
So, Daniel, I really enjoyed having you on here, man. Thank you for telling us about your experience being the first responder and all the things that you've seen with COVID. Your links are down in the description so people can check out Keto 911 podcast and just ask you about you and get to see you talk about living a life of keto and that kind of diet and stuff. And we just thank you for coming on, man.
Hey man, I appreciate the opportunity. I can't thank you guys enough. Like since Gion, we had we were on the other podcast, man, we cut loose and I'm like, look, hey, any opportunity where I can get a chance to have fun and be informative at the same time, I have no problem. If you ever need me, I'm here.
Definitely, man. Yes, we will definitely get you.
There's some keto stuff.
Hey, I got you.
Yeah.
I got you all day. Look, if y'all just want to bring me back for just health and keto, oh, don't worry. I got plenty. Not showing up, dude.
Oh, yes, man. Yes. Because, we're all about getting this information out to the public. So, yes, definitely. Yeah, we will definitely have you back on, man.
Okay.
Absolutely.
So, guys, that's our show. Don't forget to like, comment, and subscribe. Hit that notification bell so you don't miss out on any uploads. Also, you can find us anywhere where you can listen to podcasts. This is the Monday live stream. Y'all have a blessed day. Peace.